Good morning, good afternoon, and good evening to everyone joining us from wherever you are around the world. Distinguished guests, ladies and gentlemen, it is my great honor to welcome you all to this highly anticipated awareness seminar. Before we begin with our main presentation, allow me to provide a brief overview of the initiative that brings us together today. INSTAL Africa, Innovation, Science and Technology for Action and Learning in Africa, is the result of collaborative efforts initiated in October 2023. This initiative leverages the Drosophila melanogaster fly model and state-of-the-art infrastructure to enhance fundamental research capacity in Rwanda. Rwanda has made remarkable strides in advancing its scientific capabilities, recognizing the pivotal role of research in sustainable development and public health. INSTAL Africa was born from a collaboration between the Foresight Institute of Research and Translation Rwanda, or FIRAT Rwanda, and its technical partner, Drosophila UK, in conjunction with key national institutions such as the National Council for Science and Technology, Rwanda Biomedical Center, the National Industrial Research and Development Agency, the University of Rwanda, and the Rwanda Food and Drug Authority. This collaboration embarks on a 5-year comprehensive capacity development plan aimed at cultivating the next generation of scientists and fostering research excellence across medical, applied, and fundamental sciences. From healthcare innovation to agricultural production, this partnership envisions driving progress in public health and sustainable development across Rwanda and beyond. It is against this background that we convene today, united in our shared commitment to advancing science, technology, and public health for the benefit of our communities. With that foundation laid, it is now my distinct pleasure to introduce our invited guest speaker.
Ladies and gentlemen, it is our great pleasure to introduce our distinguished guest speaker for today's INSTAL Africa webinar, Dr. Opeyemi Ogunsuyi. Dr. Ogunsuyi is a distinguished biochemist, academic leader, and one of the rising voices in African neuroscience. His work is driven by a strong commitment to advancing biomedical science through innovative, accessible, and high-impact translational research models that connect fundamental scientific discoveries to practical therapeutic solutions for complex human diseases. He currently serves as an Africa Research Excellence Fund or AREF Research Fellow at the School of Biosciences, University of Birmingham in the United Kingdom. At the same time, he holds faculty and leadership positions at the Federal University of Technology, Akure in Nigeria, where he has served as coordinator of the Department of Medical Biochemistry and chairperson of the school's Research Grant Committee. At the center of Dr. Ogunsuyi's research is the use of advanced alternative experimental models, particularly Drosophila melanogaster, commonly known as the fruit fly, and now FUTA cinerea, the lobster cockroach. He is a leading advocate for the 3 R's principle: replacement, reduction, and refinement, demonstrating how these cost-effective and ethically sustainable genetic models can provide powerful insights into neurodegeneration, toxicology, and metabolic disorders while overcoming many of the limitations associated with mammalian testing. Dr. Ogunsuyi's contributions to science have earned him international recognition. He has completed prestigious fellowships and guest professorships at the Universidade Federal de Santa Maria in Brazil, supported by globally respected organizations including TWAS, CNPq, and the International Center for Genetic Engineering and Biotechnology. In 2022, he was honored with the Professor Friday Okonofua National Young Scientists Prize in Health Sciences by the Nigeria Young Academy in recognition of his outstanding research impact. Beyond his achievements in research, Dr. Ogunsuyi is deeply committed to mentorship and scientific capacity building across Africa. Through support from organizations such as the International Society for Neuroscience and the Genetic Society of America, he has organized regional neuroscience schools and university outreach programs, training the next generation of African researchers in gene expression analysis and alternative model methodologies. His work continues to demonstrate how innovative and accessible research systems can transform biomedical science and strengthen Africa's scientific future. Dr. Ogunsuyi, we are honored to have you with us today. The floor is yours.
All right, thank you. Good morning, everybody, wherever you are joining us from. It's a great privilege to have you here today. I am so honored and humbled to have been invited to present this talk by INSTAL Africa. I want to use this opportunity to appreciate the leadership of the group for this wonderful job, and it's a commendable one, especially across Africa. Rwanda particularly has been consistently and passionately driving alternative model research, particularly using Drosophila melanogaster models. In Africa, I must commend the great works. It's a lot of work. So I'm happy. I use this opportunity to appreciate the invite and the call to be here. I remember I've been to I know a couple of leading voices in Drosophila research in Rwanda and Africa. It's been a wonderful journey. And I also want to appreciate Dr. Oritoke for initiating this invitation. If you can hear me, I appreciate you for also the honor to make this talk. All right, so I believe we can see the slides. I'm going to dive right into it because I have a lot to say, and there's a lot of time just to be sure that my screen is being projected. I want it to be confirmed. Okay, let me share my screen again. Just a moment, please. All right. Okay, I'm sharing it now. All right, please kindly confirm if it's live now. Oh, just a minute. Sorry about this. Okay, now I'm sharing. Can we? I think it's projecting now. Am I correct? Okay, so I want to try and project it from the beginning now and see if everything goes well. How about now? Oh, this is getting interesting. Sorry about this glitch. All right, I'm gonna try something else. Just a moment. If it is not gonna come up, probably we may have to share it. It's showing here now, and trying to project, it disappears again. Okay. So maybe we will have to project from the other hand because. All right, let's see if we can project from the back of his end so that we don't waste much time. Okay, so thank you for that. I think I will, let's see. Okay, so I am going to try to share the screen again, and hopefully it works this time. So sorry about the network issue. Okay. Okay, please, I need to confirm. I'm sharing my screen again now. Can you kindly confirm if you can see my screen? Okay, thank you very. And sorry about the initial glitch. So I believe we can see me and then we can hear me now. So um, let's just dive right into it. And introduction, well introduced, and just you can check the QR code link if you want to know more about the type of research I do. We are open to collaboration in the lab. So that is just, I won't do much of an introduction. That has been done already. All right, so to the topic of today, we're talking about food-drug interactions in Alzheimer's disease. Food-drug interaction in Alzheimer's disease management. Evidence from the Drosophila melanogaster model. All right, so I will just do a little background about dementia and Alzheimer's disease. These are data from the WHO, the most recent data, and they are still showing us that dementia and Alzheimer's disease are still a big deal in the world, and they still requires a lot of attention, especially in the low and middle income countries, which fortunately and unfortunately we belong to here in Africa. So it's still a burden. So this continuous study about it is necessary. Hence why the story of Alzheimer's disease seems not to be going away anytime soon, because it's still, just imagine in 2019 alone, dementia cost economy globally about $1.3 trillion. That's a staggering amount, and it's a lot of burden. All right, so why is Alzheimer's disease so complicated like this? Because the disease itself it has a lot of etiologies. It's a multifactorial disease. It's a multifactorial disease, and because of these, hence the management has been quite challenging. So, from amyloid hypothesis to tau hypothesis to oxidative stress to neurotransmitter impairment to cognitive dysfunction. These diseases that affect learning and memory, especially in the aged, continues to be difficult because of the multifactorial issue. You have inflammations, you have, amyloid deposits, you have tau deposits. And because of this, studying it and management approach has been complicated because of this etiology. And, Many years ago, the story was that Alzheimer's disease is more prone in the elderly. This is 65 and above. But today, we are having early onset Alzheimer's disease. So it's not only in the elderly alone, it's even in the middle age. So, and developing therapies has been quite challenging, like I said, because of, these factorial, uh, because of these multifactorial reasons. And because of this complexity in Alzheimer's disease, there is continuous need for study, for management, for prevention, management and prevention. Like I've said, the mechanisms are so complicated. You have to deal with a lot of etiological factors, and because of this, continuous therapeutic options are being explored, from acetylcholinesterase inhibitors to NMDA receptor antagonists to dietary interventions to anti-inflammatory agents, many. And one of them is that in the past, monotherapy has been the major option, but gradually now we are seeing that combinatory therapies, polypharmacies, maybe that can do multi-target approach, to target the different etiological mechanisms, maybe the way out to much more tackle this disease instead of just going for one etiology. They maybe need to do multiple targets at the same time. So hence why the study of multi-targets. And in one of these multi-targets is to also look at interactions between different agents, that can affect the prognosis, the progression of the disease. All right. So, like I said, one of the therapeutic targets that have been explored has been diets, and especially functional foods. Functional foods are our normal day foods. They are not anything special, but they have health promoting benefits more than just their nutritional support. From your curcumins to your cinnamons, foods rich in polyphenols, rich in alkaloids, rich in phenolics. They've been shown to have health promoting benefits. And many studies have explored this functional foods as preventive and management approach, dietary preventive and management approach for Alzheimer's disease. So and even up to clinical studies have shown promises. Curcumin have shown promises, polyphenols have shown a lot of promises. There are a lot of studies that have been showing that many of these bioactive compounds are showing promises to have memory enhancing, to be able to elongate the prognosis of the disease, to bring about neuroprotections, and many of their mechanisms are by offering anti-inflammatory, antioxidants, having acetylcholinesterase inhibitory properties, and many other approaches. So, no doubt, these studies have been explored, and there are even clinical evidences to back some of them up. So they are here to stay, and they have been proven to be effective to one level or the other. Now, because of these, okay, before I go to Drosophila, because of these, there has been a lot of studies. Many studies have shown that these functional foods can be used to prevent or manage Alzheimer's disease. I want us to hold that one as we go forward. At the same time, the clinicians will still prescribe the drugs. One of some, like I said, acetylcholinesterase inhibitors is one of the most popular drugs used in the management of Alzheimer's disease. So here we have the dietary in one hand, and we have the pharmacological intervention in one hand. Those two go hand in hand. So now, but the question again is, what happens when the two of them meet? In what scenario can the two of them meet? Now, these are the questions we are going to be answering as we go forward in this presentation. So, of course, this I believe this platform is familiar a lot with Drosophila melanogaster, and I'm not going to do much about it. It has helped our research a lot in Africa, and they are known for many things. They are they've helped the research, no ethical issues, and they are fantastic. They've given out a lot of information, and you know. For as many that know, I'm happy to let you know that I've seen studies that went straight from Drosophila research directly to clinical interventions, yes, showing you the high level of acceptability and promises that Drosophila research has to offer us. Maybe for a few that may be joining us that may not be too familiar with Drosophila, I went for an outreach, brain awareness outreach in March here in the UK, and it was to tell people about Drosophila. And one small boy asks, "What is this fly?" And I remember the way I answered. I said, "This fly is about 60 to 70% of you," and we all laughed. And as funny as it is, that's just a story. Fly, as small as they are, carry about 60 to 70% disease-causing genes in humans. And that is why we are interested in it. And that is why we use them. All right. So, and these are the various pathological hallmarks that can be monitored in Drosophila. And if we are using Drosophila to study Alzheimer's, there are many Alzheimer's disease models, but in this study I'll be presenting on basically two, using meta-induced. A lot of people have used meta, especially aluminum toxicity, to induce Alzheimer's-like phenotypes, and of course the transgenic ones, using the UAS CAR4 system. They've been able to produce transgenic flies that express these Alzheimer's phenotypes, from the tau to the amyloids, and so we are going to be focusing on these two, both the metal-induced and the genetically modified Alzheimer's-like. All right, so now in this, to drive home the food-drug interaction study today, I'm going to be focusing on some of the studies we've carried out using this interesting rhizome called turmeric. Many households knows about it. Turmeric, and the major active ingredient in turmeric is the curcumin. The curcumin is the major polyphenolic bioactive compound in turmeric. Now, we are going to be starting our journey about the food-drug interaction from curcumin. Now, don't forget I said earlier that a lot of studies have shown that functional foods and their bioactive ingredients offer neuroprotective properties in Alzheimer's-like phenotypes. And this is the journey we are going to do. I want you to journey with me as we go on in building this interesting stories. So one of them is turmeric, and especially the bioactive compound in it, which is the curcumin. A lot of study, if you go online, you see a lot of study that have reported the neuroprotective property of curcumin, especially as it relates to Alzheimer's disease prevention and management. A lot of studies have reported it. And we've also done a couple of studies, even in our lab, in this regard. And let me start by presenting some of this data to you. Now, some time ago, we carried out a study like this. You can scan this QR code if you want to have full access to this publication, each of the papers. So we carried out a study to assess the effect of curcumin on acetylcholinesterase gene in Drosophila melanogaster. Don't forget that acetylcholinesterase is one of the major hallmarks of Alzheimer's disease, and hence why one of the major drugs used in management of Alzheimer's disease has been an anticholinesterase. So we studied this, we carried it out, trying to assess the effect of direct inclusion of curcumin. And I have tried to summarize the findings of this particular study. You can check the paper for more. And in this study, we saw that the survival improved, and then we saw that curcumin was able to, offer anticholinesterase activity. It reduces the activity of anticholinesterase, both at the enzyme activity level and also at the mRNA expression level, which is very interesting because when you have an anticholinesterase agent, it's very interesting, especially when it comes to the management of Alzheimer's disease, because a drug, anticholinesterase agent, are one of the class of drugs used in the management of uh, Alzheimer's disease. Now, this result was very interesting, showing that curcumin has an anticholinesterase and an antioxidant activity. Very interesting and very promising for Alzheimer's disease management. Now, we now asked a very interesting question. What if in a case whereby when you talk of prevention, you can say, oh, okay, curcumin has anticholinesterase agent, it has antioxidant properties. But then we started asking interesting questions. You know, I remember back then my supervisor, Professor Gani, also, we always, pop up these very interesting questions. And then we asked that what if in a case of a person, we're talking of prevention, what about management? Clinical studies, evidences show that this can be a functional food target against Alzheimer's disease. Fine, interesting. But in a management state, most of the time, the therapeutic intervention, the pharmacological therapeutic intervention, will not be altered, will not be stopped. Because you want to say someone should take dietary supplement or something, you are most likely not going to ask the person to go off the meds. That is one fact. Another fact is that many people take this dietary supplement without even letting their physicians know. They also take the drugs. That is another class of scenario. Very interesting scenario. So we now say, oh, what if in a scenario of someone going through the therapeutic interventions, the pharmacological interventions, the drugs, and also taking these supplements, and they seems to have the same mechanism? What are we going to get? Now, you may say, oh, it's going to be synergistic. Yes, that is a promise. But most of the time, it is not having the same mechanism is going to give you a synergistic effect. So you never can know. So this brings us to these big questions. When you have the drug and then when you have these bioactive compounds in the same system, what are the things we can get? Are we going to get an enhancement? Are we going to get an antagonistic effect? Are we going to get an addictive effect? Are we going to get no effect? Now you may want to ask, why this is important? Yes, it's important because we need to, if we get synergistic effect, then we can say, oh, okay, when you bring these two agents together, you get better effect. And I tell you, this combinatory effect has helped in developing some strong pharmaceutical drugs. Like you have some analgesics where they combine paracetamol with caffeine to give strong effect, And then if it is antagonistic, we need to send out the message that if you're on this medication, you don't take this. So it's a very interesting, open-ended research. So follow me as we look at this. So we took one interesting anti-Alzheimer's drug that is an anticholinesterase, that is donepezil hydrochloride, one of the most common and the most well-used anticholinesterase agent for the treatment of Alzheimer's disease. So in 2021, we got a grant from the International Brain Research Organization to study this interaction between this drug, donepezil, and curcumin from turmeric. We started the study then, and let me take you through some of the interesting findings we have. So in one of the study, we examined the effect of the curcumin and the donepezil on Drosophila melanogaster in this study, we used aluminum chloride metal to induce Alzheimer's-like phenotype. So we first used the environmental toxicant aluminum to induce it, and then we investigate the cholinergic system and the antioxidant system. So I will just quickly, because of time, take us through some of the results we got. So we could see, now these are the behaviorals. Let me take you to the memory. We could see that in the aluminum, predictably, reduced the memory index in the flies. And we were able to see that when they were given either curcumin or donepezil, the memory was ameliorated. Now, let me quickly point your attention to an interesting aspect of the study. We saw, if you notice here, we use donepezil at two levels, at 25 microgram per ml, and then at 112 and half of the dose, 25 and 12.5. Now, why did we do this? We want to also see that when we reduce the dose of the drug and then we kept the curcumin constant, are we going to get a reduced effect? Are we going to get the same effect? Why we did this was because donepezil itself has some side effects, many side effects. And then if we can reduce the drug dose and then we combine it with curcumin and then we got maybe the same level of results, then reducing the dose may even be more interesting. And interestingly enough, if you see that in the groups we gave aluminum, in the group we gave curcumin and donepezil at 25 microgram per ml and at 112.5, which is half of the initial dose of donepezil, we had no significant difference in their memory enhancing ability. Very, very striking, very interesting, showing that even when we reduce the dose of the donepezil by half and we kept curcumin constant, we got the same effect if we used donepezil at twice the dose. This was very, very amazing and very interesting, showing that even halving the drug, which potentially can reduce the side effects, you still get the same effect. Very interesting. So, of course, we look at the acetylcholinesterase activity. Expectedly, there was shoot up in the acetylcholinesterase activity in the aluminum-induced flies. And then again, if you look at the amelioration in both the main dose of donepezil and half of the dose of donepezil with curcumin, we also had no significant difference. Very interesting, showing that we can have the dose of donepezil and still get the same results when we combine it with curcumin, of course. And then, of course, we did other antioxidant activities, and then we saw that the antioxidant activities were interesting, although they didn't, when we combined them with curcumin, the drug with curcumin, we didn't get much antioxidant effect. That wasn't surprising anyway, because of course donepezil itself is not a major antioxidant agent. But of course, the interesting part was the anticholinesterase agent, and then also being able to offer some level of antioxidant effect. All right, and then also the gene expression level. We look at the gene of the acetylcholinesterase, and we got very interesting similar results. If you look at the acetylcholinesterase gene here, the amelioration, no significant difference. Now, what is the take home for this? The take home from this story is that when we combine donepezil with curcumin, we got ameliorative effect. Now, the interesting part of this first study is that when we have the dose of donepezil, we still got no significant difference in the amelioration, as well as when we used twice the dose of donepezil, keeping curcumin concentration constant. That was interesting, an interesting preliminary result. Okay, now, so going forward, we took another study. Aluminum is an interesting compound that will induce Alzheimer's-like phenotype. It will bring about the reduction in memory. It will increase the acetylcholinesterase activity. But we took the step a bit further, and we wanted to see a more a more holistic approach. We wanted to see more direct effects. So in this next study, we looked at, we carry out the same study that I've showed you earlier, but this time around we now use transgenic flies. Now, what is the difference? Now, in the first time you had aluminum chloride to induce the study. So there are a lot of the mechanism by which aluminum chloride induced this, though it's still not well known, but could be by oxidative stress. So there are some argument that, oh, okay, it could be a wide brain-like insult. Are you getting it? So we decided to go more direct using Alzheimer's disease model of transgenic flies and then see if we would be able to replicate the same effect as we had when we use an environmental toxicant. Now, so in this particular study, we used the UAS GAL4 systems to produce the flies that expresses amyloid precursor protein and beta secretase. Now, quickly, what are these amyloid and beta secretase? If you look at in the amyloidogenic pathways, amyloid precursor proteins are cleaved by beta secretase and they produce the beta amyloid, which is one of the hallmarks of Alzheimer's disease I talked about earlier. So you have beta secretase and then you have amyloid precursor proteins, and then they give you beta amyloid, which eventually is one of the hallmarks seen in Alzheimer's disease. So in these studies, we expresses human amyloid precursor protein and human beta secretase in Drosophila melanogaster using the UAS GAL4 systems, and they were able to and the progeny produce the human beta amyloid. Now, why did we use human? We use human because Drosophila themselves have their own amyloid precursor protein and they have their own beta secretase. But the difference is that even when you upregulate the Drosophila amyloid precursor protein and beta secretase, they will not be processed to produce beta amyloid like we will see in humans. So that is why we are expressing the human versions that when they are upregulated, we produce beta amyloid, which is the hallmark, one of the hallmark of Alzheimer's disease. So these are the flies we used in this study, and expectedly, we could see that the memory were impaired. Again, the third graph on my hair in the flies expressing the beta amyloids, and the memory was reduced. And we also saw here that the combinations led to ameliorations in the reversal of the memory reduced in the beta amyloid flies. Now, don't forget that the first study I showed you, we were able to see that when we had half dose of donepezil combined with curcumin, we had no significant difference in the memory enhancing effect compared to when we compared curcumin with the original dose. But here we had even a more striking result that baffled everybody, which was that when we even have donepezil, we were getting a better memory enhancing effect. This was a very interesting and very striking result, and which was is unprecedented. We had to check again and again and again to be sure we actually seen the same thing. So it's not just corroborating what we saw in the first study, but it's even showing that in the transgenic fly, which presented a more holistic approach of what we are seeing in an Alzheimer's disease phenotype, reducing the dose of donepezil, combining it with curcumin, we even give a stronger memory enhancing effect. So we tried to study the mechanisms by which this could happen. We looked at beta secretase, it was elevated, and then we had enhancements, and then we also did gene expression analysis for both human beta secretase and the human amyloid precursor proteins, and then they corroborated the behavioral phenotypes we saw, further supporting the fact that combining curcumin with donepezil does not only gives a ameliorative effect to the Alzheimer's disease like phenotypes, but even when we still reduced the donepezil by half of the original dose, we even got a not just the same effect, in some cases we got a stronger effect. Now again, this is an interesting outcomes, and we're still looking further even at the mechanisms by which this could be possible. But these are very interesting promising results. And again, we looked at the antioxidant, and interestingly too, we could see that when we combine curcumin with donepezil, there were interesting enhancement of the antioxidant effect of the combination, which is even very promising, because that means this combination is expanding the frontier of the therapeutic intervention of donepezil. By combining it together, then you get not just it's no longer an anticholinesterase agent now, but the combination is now a potentially stronger anticholinesterase agent, and as well as an antioxidant agent. All right, so these are more antioxidant studies. So as a summary of this, our second study, we could still see that when we gave transgenic fly expressing human amyloid precursor protein and beta secretase to when we administer curcumin and donepezil for them, we still saw that there were neuroprotective properties through mechanisms including reducing the beta secretase activity, enhancing the oxidative stress, boosting the memory impairment. And don't forget, the take home here is that it supported our first study. The second study even further corroborated the first study, that when we reduce the dose of donepezil by half, we still got a neuroprotective effect similar to when we use the original dose of donepezil with curcumin. And even in the transgenic fly, the memory enhancement was better, and it was an outstanding result. Now, my time is fast running. Now, we ask whenever, for the fly community, I know I'm not the first person that would have experienced this, but in the fly community, one of the things we always encounter when we present our results to non-fly researcher is, how are you sure this can be reproduced in other models? How are you sure this can be transmitted to humans? This is just an insect and everything like that. I believe many of us working in Drosophila will have had this interesting experience. Now, of course, most of the time it could be very frustrating because you've done a lot of jobs, and someone that is not in fly will try and say, oh, are you sure the fly model can reproduce this result? Are you sure this result? And some will even come up with other arguments. Is the metabolism the same? Is this and that? Okay, fine. My approach is never to be upset or to be angry. I took it in good faith, and it's always a call for more studies. And for this particular research, we decided to answer the questions before they come up, that can we reproduce these results in another model? Let's say rodent models. We needed to be sure so that we can convince the community out there that this is what we are doing. We are fly group, we are fly people, but we need to convince you more. So we need to do this for you so that you know that, okay, this is not just seen in flies, this can be seen in another model. So we tried to do model correlations. We picked the rodent models. We wanted to see if we can reproduce this effect so that we can convince both the fly and the non-fly community that whatever we are seeing, it's actually real, and then it's promising, at least at the stage of preclinical studies. So in the studies, this was one of the studies we did many times ago, led by a wonderful, fantastic researcher, Dr. Opeyemi. We looked at the anti-amnestic effects of curcumin in combination with donepezil. In this case, we used rodents, and then because of time, I just tried to use AI tools to summarize the results. So in this study, we gave curcumin was administered to donepezil. Dementia was induced in Wister rats with scopolamine interperitoneal injections, and then they were administered curcumin and donepezil together. And similar to what we saw in flies, it also led to the ameliorations in the combined therapy enhanced the reduction in the elevated acetylcholinesterase and butyrylcholinesterase activity, and still offered antioxidant effects. We can, if you need more information about this study, you can scan this QR code and you get full access to this paper. And this was a good result for us, showing that we could reproduce to a large extent what we saw in flies, even in rodents. Now, but this study left a gap. In this particular study, the whole brain was used. The whole brain was used in this study. Now, the question again is, you cannot put the whole brain together. The whole brain is made of different regions doing different things. Okay, so we went one more step further, and then we carried out the same study that like in the rodents, curcumin and donepezil combination, the one similar to the first one I showed you, but this time around we did not just study the entire brain as a region. We decided to study two main regions of the brain that are consistent with Alzheimer's disease, which is the cortex and the hippocampus. So we wanted to see, are we going to get the same result even in these different regions? And again, similar to the first one, scopolamine was used to induce dementia, and curcumin and donepezil were administered, and then the brain cortex and hippocampus was evaluated for the acetylcholinesterase activities and the antioxidant effects. And we also carried out some studies on the inflammatory markers like GFAP and IBA1, and we still saw similar interesting effect. And for most of our studies, the effect in the cortex was not significantly different from that in the hippocampus. Now, what this result told us that what we earlier saw in the first study in the whole brain was reproduced largely in the cortex and in the hippocampus. So it is not like we were just saying the whole brain. Now we can be sure that, oh, okay, these effects were recapitulated, were reproduced in the two main regions associated with learning and memory in the rodents. No, what this made us happy was that our hypothesis about combining donepezil with curcumin has been studied in flies. We've used environmental flies, we've used transgenic flies, and to a large extent, we've been able to also reproduce these studies in rodents, and we've been able to get interesting studies. So our next focus is clinical implications. We want to see how we can also move this to the next level, and we are open to collaboration in these. If you are a clinician in the house, you are a clinician with Alzheimer's phenotypist, feel free to contact Alzheimer's. You are specialized in the area of maybe Alzheimer's disease, please feel free to contact. We're open to collaboration. We want to take this further and then to be able to see how we can further convince the world that this combination might be a promising target for Alzheimer's disease management. So, and we are envisioning, this as providing an advancement for Alzheimer's disease treatment. It looks promising at the level of which we have studied it, but we believe that with more studies, it can be a means of precision medicine, and then it can help to give more treatment. And then by this, we are also advancing for more studies in this area, that can help with Alzheimer's disease treatment. All right, so as a round-up strategy for future research endeavors, like I've said, we are investigating novel therapeutic mechanisms, not just for these studies I've shown you, but for many other studies. We are trying to advance in analytical techniques, identifying novel markers, and like I said, going into clinical evaluations, to provide more support, for the evidence we have now. Now, quickly, the first one we make need to quickly, just dive a little into what I am doing presently here, in University of Birmingham. Now, I talk about investigating neurotherapeutic mechanisms. So, having done all the studies, there's a question that keep also coming in. We've been able to see that these interactions, they offer therapeutic effects. But a question that keeps coming in is that when we talk of Alzheimer's disease, are there sex differences in the way they are expressed? If there are sex differences in the way they are expressed, then there may be need to also investigate sex differences, gender differences in the way we do therapeutic approach. Now, you remember that all the studies I've told you about earlier on, I have not said, oh, male and female. We've always been using both genders or sometimes just one gender, especially when the rodent case is concerned. So the target we are having now, our future perspective, to show if Alzheimer's disease phenotypes has gender differences. And thanks to the AREF for sponsoring the current study. And the promise of this is that by the time we are able to see if there is a gender difference in these expressions, then we may need to also go back and start evaluating that these are our therapeutic options we are proposing. Are they sex difference? Then are there going to be ways males should be handled from the females? Is there going to be dose difference between males and the females? So it's another very interesting open-ended research, and they hold a lot of promise. So I appreciate Ariel for the opportunity, and the host of the lab, Sarah, for giving the opportunity. So for this particular study, we are also using transgenic flies, where we are expressing the amyloid precursor protein and the beta secretase in brain of fly, particularly in the cholinergic neurons of flies, and then using the GAR4 cholinergic GAR4 systems, and then we are checking for the brains of the flies. So, in conclusion, food-drug interaction approach to Alzheimer's disease management is presenting a pioneer paradigm in therapeutic strategies. Is worth evaluating, is worth studying, and then it's something that may give promises. We answer a lot of questions. First question is, when in the management approach, if you can't stop a Alzheimer's disease patient from eating, and you can't stop them from eating some foods that contain bioactive compounds, hence the need to know if these interactions will be beneficial, will be antagonistic. Then, if they are going to be beneficial, can they be used to enhance the therapeutic potential of existing pharmacological agents, like we've seen for other drugs? I gave the example of some brands of paracetamol that contains caffeine to enhance their effect. And if they are not beneficial, can we go out there and make a case to let them know that taking these two will not, help it may be antagonistic to the therapy or the drug you are using. And finally, if we reduce the dose of the pharmacological drugs, especially in a case where they have adverse, when they have side effects, can the food bioactive compounds, which we are combining them with, augment, or give us the same effect when we use the food dose, like we have seen from the evidences from the results we have presented. Okay, so these are promises that shows, but for now, let me say that the results presented are purely preclinical. They are not for prescription purposes. For now, we're still aiming to do more clinical evaluations about it. But for now, at this level, our evidence has shown that food-drug interaction is a promising approach, and particularly for the one we've studied, it's showing that when you combine curcumin with donepezil, either at full or half dose, using Drosophila melanogaster as model, we can get even an enhanced therapeutic effect, and not just an enhanced, but a broader one, because it's not just enhanced their anticholinesterase property, but it also confound them antioxidant property, which is a promising target. I believe the pharmaceutical industry, the food industry will find this very, very interesting. So we are moving to the next level, which is we aim to move to the next level, which is to do some clinical evaluations, and then we are welcome to collaborations in these areas. I would like to appreciate all these funding agencies that have funded my research over the years. I'm grateful to them. Currently, I'm on the AREF Africa Research Excellence Fund. I really appreciate AREF for making me to be here in Birmingham at this time, and then for Hebrew too, for sponsoring greatly some of the research I presented. Now, these are some of the labs I've visited. I want to appreciate them, and it's been a wonderful time, doing research across the world. And I want to appreciate my collaborator, my mentor, my supervisor, Professor Obo, has been a wonderful person, giving platforms for some of us to grow and be seen. I appreciate him for the opportunity. I also want to thank my current host here in the University of Birmingham, Professor Karidna Resava. She's been an amazing woman. She's been supportive, and she's made all the works to be interesting. Again, I want to appreciate my collaborators. I want to really appreciate Professor Imoz Abolaji. Many of us in flight community in Africa know Professor Abolaji. I owe all I know in Drosophila to God and to Professor Abolaji, who showed us the way. He's been a wonderful person. I really appreciate you. And finally, I want to thank Mr. Africa again for this invite, and I want to thank Dr. Oritoke FUTA, my wonderful colleague, for facilitating this talk. So, life permits me, I'm a faith person, and I like quoting this whenever I give talk. It is by the grace of God. Whatever we do, whatever you've seen, has always been by the grace of God. Thank you very much. I am grateful. It's wonderful to have been privileged to give this talk. Thank you for bringing me here, and I believe we can have sessions for question and answer now. Thank you very much.
Hello, Prof.
I can hear you.
Can you hear me, please?
Yes, I can.
Please, I have a question, please. Okay. I observed you have done a lot on donepezil. Yeah. If peradventure, I don't know if peradventure you have done some study on liver stigma. I don't know.
I know in this I've not, in terms of food-drug interaction, I've not done much on the rivastigmine. It's most of the time I've always used a donepezil, so I really don't have much information about the rivastigmine, as in using it for as a positive control. No.
Okay. Thanks so much. I think the questions will be on the chat box, if there is any.
Okay.
Yeah, the chat box, please.
Oh, I think I have a lot here. I'm trying to scroll up. Okay. I'm trying to see. Okay, I am still waiting. Okay, no questions yet. Maybe we just wait a little. No, why would, just to expatiate more on your question, while we wait for other questions, why we took interest in donepezil was because it was one of the anticholinesterase that is readily available. affordable and equally quite available. Rivastigmine may not be easily affordable and available like that. So we, especially when you are talking of research in Africa, we went for something that we know that would probably be the first line of use because of its affordability for people. So, hence the reason for that. But it will be quite interesting to also explore investigate. It will be quite interesting also.
Why I'm asking this is because I have used rivastigmine for someone
Okay.
For a long time, and I have observed a lot of things.
Okay.
So I'm just trying to be inquisitive about the likely things that are associated with the use of. I use it for to be specific. I use it for the treatment of my dad before before he died.
Oh,
So
okay.
at least I used it for nothing less than 6 to 7 years. So, but unfortunately, some other things came up and he's gone. So, but we thank Almighty God for everything. So I'm just trying to see. Although I also used donepezil at some point in time during COVID, but I observed the effect of donepezil is not as I believe is not as effective. Maybe on him, not as effective as rivastigmine.
Okay, well, I'm not a clinician, so whatever opinion I give, you cannot take it to the bank. But what I know is that all these anti-Alzheimer's drugs, they always have a plateau phase. I know that one. What do I mean by plateau phase? They always have a time where they become less and less effective. In fact, that is the reason why we wish to take our current study to the clinical evaluation. Because, for example, donepezil gets to a time whereby it plateaus, the effect plateaus, and you don't get any good result from it again. And I think at that level, the clinician will probably have to retitrate the patient and probably have to change the dose or administer another one. So I don't know if that's the same case with rivastigmine, but I know because of donepezil that they always get to a plateau phase, and at that point it just doesn't. And don't forget that, like I said earlier, they also have their own attendant side effects.
Yes, exactly. The same happened to rivastigmine. It got to a point we had to be increasing the dose. We increased and increased and increased. Then at times we tried to, we try to switch to the use of donepezil. Then we come back to rivastigmine. So, but unfortunately, it got to a stage where we couldn't control some things, and we thank God. We thank God for life. But
So
now he's gone, so that's just it.
so sorry about it.
So,
Sorry.
all right, my
So
pleasure.
sorry. Yeah,
Thanks so much.
I have two questions dropping. The first one says, what specific mechanisms explains the interaction between curcumin and donepezil in improving Alzheimer's-like symptoms? Thank you for this question. Now, the mechanisms are two. I will just focus on maybe two or three. The first one is the anticholinesterase effect. Now, like the first study I present shows that curcumin itself, which has been reproduced in a lot of studies, curcumin have anticholinesterase effect. That is established. The same thing to donepezil is an anticholinesterase drug. That is established. So bringing the two together, I believe one of the reasons why we have the result we have is an enhancement of the anticholinesterase properties of the two of them, which so we can mark anticholinesterase as one of the mechanisms. The other mechanism is antioxidant. Now, curcumin itself is an antioxidant agent, and donepezil is not too much of an antioxidant. So by combining them, you are conferring antioxidant properties on donepezil by bringing it to. So by the combination, you have anticholinesterase and you also have antioxidant mechanism. Now, the third one, which time did not allow me to focus on, is on the monoamines. Monoamines, curcumin has also been shown to inhibit monoamines. Now, when I mean by monoamines, I'm talking of the dopamines and the serotonins, and then studies have shown that these are linked with Alzheimer's disease as well. So we were able to see that curcumin being a monoamine oxidase agent, also when we look at the combination, we also saw some increase in monoamine oxidase activity. Now, let me add this one. When we even talk of acetylcholinesterase inhibition, now there are two types of acetylcholine, and there are two types of cholinesterase inhibitors that are at play in Alzheimer's disease. We have the acetylcholinesterase and we have the butyrylcholinesterase. Donepezil will act more on an acetylcholinesterase and less on butyrylcholinesterase. Now, when studies have shown that when Alzheimer's get to some late stages, acetylcholinesterase may no longer be the problem, but butyrylcholinesterase becomes the problem. Whether or not that's why donepezil no longer works at advanced stage of Alzheimer's disease, I may not be able to say for sure because I'm not a clinician, like I've said. But what I know is that butyrylcholinesterase is the second type of cholinesterase at play in Alzheimer's disease. Now, donepezil works on acetylcholinesterase is more specific for anticholinergic, less specific for butyrylcholinesterase. Curcumin is an inhibitor of both acetylcholinesterase and butyrylcholinesterase. So when we combine the two together, donepezil no longer becomes specific for acetylcholinesterase. The therapeutic window has now widened. It can now inhibit both acetylcholinesterase as well as butyrylcholinesterase. So this is another very interesting study. Why I didn't show that result in fly is because in Drosophila, there's no distinction between these cholinesterases. So if you want to get that picture, then you may want to go to the studies we did on rodents, because in rodents, the two distinctions of these two acetylcholinesterase and butyrylcholinesterase is more clearer in rodents. But as far as we know, this may be an additional mechanism. And then you saw me talking about inflammation too. We saw some interesting anti-inflammatory effects. So to the next question, you said, what type? Now, this is you will see that when I've been talking, I was expecting this question. I've been avoiding to use the word either synergistic or additive. Now, the reason why I'm being careful, because I don't want to be sued by the pharmacologists online for me to say it, because the result we have is a collections of a lot of data. We have, don't forget I said that Alzheimer's disease is multifactorial. So if I say anticholinesterase is synergistic, antioxidant may be additive. So that is why I cannot say definitely, because it's a collection of multiple targets. We are not just approaching one target alone. So when you look at it together, we may not be able to say all are synergistics. All the mechanisms that were explored as synergistics are all are additives. So we have to pick them one after the other. So it depends on the one you want to focus on. But one thing is sure that they were enhancement. So it now depends on the mechanism they are targeting. Is it acetylcholinesterase? Is it antioxidant? Is it inflammatory? That's the one that will give you. But overall, it will be difficult to give direct. Otherwise, we may be stating the facts. So it is better to be more specific about which target. Now, why should we not be point to one target? If we point to just one target, then we defeat the purpose, because the purpose itself is to widen the therapeutic option, and that's where we have to talk about the multiple targets. Then the next question, it says the presentation mentioned sorry. The differentiation mentioned sex differences in behavior and cholinergic neural loss. What preliminary evidence suggests males and females respond differently in this? Yes, thank you very much. That is an ongoing study. That is exactly the study I'm carrying on here in the Birmingham. And I must tell you that the result has been very, very interesting. It's still at the very preliminary stage. That's why I don't want to present it any better yet. But I can tell you that we've seen sex differences. Interestingly, we've seen sex differences. And for now, in Drosophila that we are using, uh, my own expectation coming to this study, based on what I've seen and based on data, even the WHO says, women are more at risk of contacting, or sorry, not contacting, of developing Alzheimer's more than males. Now, but having the disease is one issue. The prognosis of the disease is another issue. So first thing I would say is that in this study, we are not looking at which gender is easy to, or we easily start to have Alzheimer's, because we have already induced the Alzheimer's in the flies, but we are only looking at the prognosis. So I'm saying this so that I put it in the proper context. We are looking at the prognosis of the disease as the disease progresses in the flies, in the transgenic flies. Who is more? Which of the gender is more at risk? And for now, it's showing to me that the males are more show more effect as the pathology progresses. We are doing the study from day one. We're looking at time points. We are looking at the 3, the 15, and up to the 30 of the flies. And as it progresses, we are seeing that the males may be at more risk of the progression of the disease. This is very interesting. This is very surprising. I must tell you, myself, I came into this study thinking the females will be more at risk. No offense, please. That's just my own hypothesis, but it's surprising for me to see so far. And I was discussing with my host some time ago, and she said this is surprising. But one thing she told me is that it confirms their own stress. They are also have another study on stress, and they are looking at the stressors in females, and they say, oh, okay, maybe because the females are more resilient to stressors. Maybe that is why we are seeing more progressive effect in males. Like I said, it's still a preliminary, but I can tell you that there are sex differences, and it's pointing more to the males. And then we are thinking of maybe females, because of their whole sex hormones, and they are more resilient to stressors than males. So it's an interesting event. I hope in the future I will have a platform to also present this study, and then when we have more and more evidences, we are looking at the fly brains. We are doing immunostainings. We are checking we want to see in situ how this expression goes, and we're also doing behavior. So thank you. All right, let me look at the next one. What future research direction do you believe has the greatest potential to change Alzheimer's management over the next decade? Thank you for this question. Believe me, I will say it is combinatory therapy. Combinatory therapy is the way forward. Why do I say so? My own opinion, I say, because Alzheimer's disease is multifactorial. Let me give you one interesting complexity about Alzheimer's disease. During my undergraduate master's days, even up to my early PhD days, what we used to hear is that amyloid hypothesis, amyloidogenic pathway, is the major hallmark of Alzheimer's disease. Then that changed in the last maybe 2-3 years, and then we started hearing that tau hypothesis is the main hypothesis. So in fact, that alone is enough complexity on its own. So we need to have combinatory therapy instead of looking for one single agent, because if your agent is able to, and again, up to now, Alzheimer's disease still looks like the hen and the chicken mythology. Which one came first? is it the hen that came first or the chicken that came first? I don't know if you understand what I'm trying to say. The chicken came from the hen and the hen came from the chicken, but the question is, which one came first? Now, this is the issue, because at the end of the day, there's a tau, there's amyloid, there's oxidative stress, there's inflammation. Which one is causing which? Which one is leading to which? It's still although there are a lot of informations about this, there are a lot of evidences about this, that this is upstream of that. But again, there are not solid, finalized information to show us that this is the entire progression of the disease. So this is why multifactorial investigations will be interesting. And it's only a combinatory therapy approach that we offer this. So we need to continue. And in Africa, let me come to Africa now. We are blessed with a lot of all these natural agents, and what we just need is we need to look at them. We need to see how we can synergize our research together, and then look at multifactorial, multi-target approach. This is I believe, and this we call for collaborations across different fields. This we call for collaborations across different fields: the pharmacologists, the food scientists, the biochemists, the clinicians. We need to collaborate and come together. And I believe there are a lot of platforms by which these are already being done. We just need to key into it and move forward. So I strongly believe in a multi-target approach, a combinatory therapy approach, and then this will give us a more robust idea going forward. Thank you.
Okay. In the absence of any other question, on behalf of FIRAT and the Innovation Science and Technology for Action and Learning in Africa, we would like to extend our profound gratitude to Dr. Opeyemi Ogunsuyi. Thanks so much for your wonderful lecture. Really appreciate it. And to all our listeners, kindly stay tuned to witness more of these wonderful sections. We say Murakoze Chani, we say thank you so much for your wonderful attendance. Also, our listeners, we would like to indulge. Our listeners, we would also like to indulge you to subscribe to our channels at FIRAT Africa on YouTube. Also, we would like to indulge you to look out for our programs such as the Mental Health Dialogue Series, Dental Medical Chronicles, STEM Talks, and many more. On this note, we'd like to call it to an end. Thanks so much, everybody, for being here. We appreciate everybody.
Thank you.
All right.
Thank you. Bye-bye.
Bye. Thanks.